Doulas were once considered a luxury, but South Carolina may be the latest state to cover these services through Medicaid. Well, here to share more on how peer recovery doulas are providing vital support for perinatal substance abuse disorder is Dr. Courtney King, Assistant Professor of Psychiatry and Director of Rebirthed at MUSC. Glad to have you with us.
Thank you.
So it's a little bit of a mouthful.
It is.
Perinatal doulas. What is the difference between these doulas and sort of your average garden variety?
Yeah, so we train community doulas specifically, and community doulas are trained or apprenticed individuals who provide non-clinical, physical, emotional, and educational support. And they do that through the entirety of pregnancy, labor and delivery, and up to a year postpartum. And what's really special about community doulas is they are really well versed in the community that they serve. So they often have lived experience, similar lived experience as the mom that they're working with. So sometimes they're community doulas who are deaf and disabled, and they work with deaf and disabled moms, or they're community doulas who had a teen pregnancy, so they work with teenagers.
Oh, interesting. So they match from their own personal experience to the person that they're serving. That's really interesting. So for anyone who's not familiar with a doula, the term in and of itself, it doesn't sound like it comes from the English language per se, but what exactly is a doula? What is their function?
Yes. So a doula is that non-clinical support. Sometimes it's confused between doulas and midwives. Midwives are clinical, but they provide the educational, emotional, and physical support. So they're hands-on during labor and birth. They help people navigate the medical system. They help them learn about what's going on and advocate for themselves during birth and labor.
They do a lot.
They do a lot. They fill in a lot of gaps in the healthcare system.
And especially if you're, say, a first-time mom and you have absolutely no experience, no history, you don't know what you don't know, and then you have someone to help you navigate the very convoluted, complex maze of becoming a mother.
That's correct,
While you're exhausted, while you're, probably scared out of your wits about the future. So it sounds like a very grounding force.
Yes, they are incredible. Like I said, they help moms advocate. They really help moms understand what's going on with their bodies, what's happening and changing their lives. They help them figure out parenting in the postpartum and all of the changes that come. It can be really scary for first time and second time, third time moms.
Indeed, absolutely. And then you also work with, or the doulas do work with people who've had substance abuse issues in the past, which I think is really interesting. Is that a very common thing?
So actually, some people would be surprised to learn that mental health issues and substance use disorders are the most common complication of pregnancy and childbirth. So 1 in 5 women will struggle with some sort of mental health issue. And that's just the ones that we know about. It's often underreported, undertreated. So it's a big issue for pregnancy and postpartum.
So does a doula have these conversations that they're kind of a sounding board? It almost sounds like they're also a therapist or someone who can kind of come in and offer some of that emotional support that you would find maybe in a more clinical setting.
That's correct, So a peer recovery doula specifically is somebody who is a peer support specialist, meaning they're trained to support people in recovery based on their lived experience. And then they're also trained as that doula, so they can provide support for recovery as well as the birth support. So it's really this just combined person who can walk with you in that potentially difficult time in your life.
How do you go about finding these people? Because they sound like they're angels on earth.
Many of them are angels.
Such a holistic, support for these moms. So where do they come from? How do you find them?
That's a great question. And when I created this program, I was concerned that there wouldn't be a lot of moms that wanted to recover out loud. There's a lot of stigma and shame around perinatal substance use disorder. And I just kind of put the word out there into the recovery community, and to my surprise, a lot of women wanted to support other women walking on the same journey. They had a really tough time in their pregnancy, and they want to be the person that they didn't have.
That's incredible. How long has this program been going on?
It started in 2022, and that was really just the beginning stages of it. We've now trained roughly 18 peer recovery doulas across the state. And so.
How does it get paid for?
It is grant funded at
It
this
is.
moment, yes.
Okay, so no cost to the
It is no cost
mom.
to the mother who's receiving services.
And how do they find out more information? So if they're watching this and they think, I could really use this help,
Yeah.
where do they go?
Yeah, so you can find us on Instagram at Rebirthed_SC, South Carolina.
Yeah.
And the program is at MUSC. So if you were to call the Women's Reproductive Behavioral Health Division, that's the division I am in, and talk to one of our care coordinators, they'll get you linked up with somebody who can provide support.
Thank you so much, Dr. King, for
Thank
sharing with
you.
us. It's been great to talk to you.
Yeah.
We'll be back after this.